Some good news for people with serious heart trouble.
The FDA has just approved a new way to replace a diseased heart valve without surgery. CBS News' Dr. Max Gomez introduces us to one of the first patients in the country to get the new valve.
I was told when I came here, if I didn't do it now, I'd have a 2-year survival rate.
Frances Giannatimpo got that disturbing news because the aortic valve in her heart had built up calcium deposits on it.
Instead of the valve opening very wide and letting the blood out, it gets narrow, and so your heart has to work very hard to pump all the blood through a very small opening as opposed to a big opening.
The heart then has to work extra hard to pump blood through the small opening, which over time,
muscle function decreases, the symptoms get worse, and it'll eventually kill you.
This is a disease mostly of older people for whom major heart surgery to replace a heart valve would be very risky. Frances has arthritis, osteoporosis, and COPD from 25 years of smoking on top of the bad valve.
Shortness of breath, if I climb stairs.
But now doctors have developed a way to replace a stenotic aortic valve without surgery. Here's how it works. A long, specially engineered catheter is inserted through an artery in the leg. Inside is an expandable metal cage containing a soft tissue valve. Dr. Williams carefully positions the valve inside the old one. Unlike older systems, this valve can actually be repositioned if it's not perfectly placed.
This basically gives us a mulligan, so we can reposition the valve. If we don't like it, we just reposition it, and that really allows us to optimize the outcomes with the patient.
This is Frances just 10 days after her procedure. She was home in a day and a half, virtually pain-free, and
yesterday I went for a pretty decent walk, and I had no shortness of breath.
pretty amazing for a 75-year-old. Now, the tubes used to put the valve in are thinner and smaller than older systems, so this procedure called TAVR can be done on almost anyone who needs an aortic valve replaced, including much smaller women like Frances. All in all, a much easier way to get a new valve in than open heart surgery.
And what a difference with recovery.
Oh, tremendous difference in recovery. She walked a few hours after the procedure.
Surgery with a mulligan. Never heard that one before. That's pretty good, though.
That's right. I thought some golfers would appreciate that.
A nice do-over. Thanks very much,
Thanks,
Max.
Dr. Max.
Well, up next.